So I was speaking at one of the satellite symposiums yesterday that was exploring new therapies in AML and whether or not we should be taking a targeted therapy approach or an immunotherapy based approach, both of which are very topical areas. So the talk I was giving was to set the current treatment landscape in AML and discuss what the current standard of therapy is and what clinical trials are currently available in the UK, and sort of set things up for the debate that was to follow. So there's a number of different clinical trials at the moment in the UK, and they're split depending on the age of the patient and also the intensity of the treatment given, which allows you to, particularly for older patients, give intensive therapy to some patients or less intensive therapy for patients that are perhaps less fit or are very elderly. And wherever possible, we try to put patients into clinical trials because we know that patients in clinical trials tend to do better than patients that are not in clinical trials. We're just on the brink of lots of new therapies for AML, but I think it also highlighted that it's unlikely that there's going to be a one therapy fits all approach for AML. I think it's likely to be, because it's such a heterogeneous condition with lots of different underlying mutations, that there's going to be lots of different therapies for small numbers of patients, which in itself makes undertaking clinical trials difficult because it's going to have to be across multiple countries and probably take a long time to recruit. So I think it's a very exciting time, but it's also very challenging.